So we're going to talk about the training on surgery for cancer in sub-Saharan Africa. So as you know, there are many modalities for treatment of cancer, and one of the easiest the most effective treatment option when the indication is fine is the surgery, and also that's the modality that requires the least the least infrastructure. We have difficulty of accessing to drug when it comes to chemotherapy. Radiation therapy is very expensive. Then surgery should be a very effective way of managing the patient, and we need to be trained appropriately to do that surgery for the patient. Okay, we have basically three ways of training the people. The first one is during the residency program. The resident, as when they train as to be a urologist, they should also be trained to do the surgery for urological cancer. But you will understand that the limitation of this modality is it depends on the trainer. Did they have fellowship? Did they have a proper training in surgical oncology? So this is then the resident may end up having a roof in terms of achievement, in terms of skills that are learned depending on the trainer. So this is the number one. The second option is sending people away to do a fellowship, going to the US, going to Europe, going to any part of, or even within Africa, for in centers that have the facilities and the skills. But then we end up having a surgeon that is trained, that have the skill, but when he comes back to his country, he may face some difficulties, readjustment, difficulty of having a teammate who are not trained the same way he used to be trained, or just not having the required equipment. And as a consequence, many fellows return to where they were trained, and we have a brain drain, and that is not effective. And we thought that the best option, which is the third one, is to be trained on site. Even if initially the skill wasn't available, we can have experts, a team of experts. I mean, a team of experts, I'm talking about our experience, where you have the surgeon, nurses, anesthesiologists, etc. They come, and where possible, they come with equipment. And the good thing is that they're going to train the surgeon in the natural environment. They're going to train the nurses and all the required staff, and they will have the support of the local authorities. And that way, they will leave the same team with the same patient, with the same environment, and they can organize follow-up. That way, we can have a strong team. Yeah, I think definitely we need to do, and that gives me the opportunity to talk about a collaboration that we have from our center and other centers in the world. The most of the one of the most effective of them being with an NGO called IVUMed based in the US, where we have the experience of this expert coming for a few years in different specialty, including surgical oncology, where we have the partnership that allow us to be trained in our center, but allow us also to have continuing medical education through renewed session, but also through distant learning, where we have a kind of telemedicine, not always formal, but where we share the medical record, we share the images, and we discuss the indication, and we found that is very effective. That is effective not only for the surgeon trained in the specific centers, but that can end up having hubs where other surgeons can come from other centers within the same country or from neighboring countries to be trained, and that fall into being trained in very similar environment. So that's something we need to do, and that should be part of the national plans, because that is, as I said earlier, a very effective way of controlling the cancer if the patients are selected early enough, and that will reduce the necessity of using drugs or any other treatment when they are not already available.